All right, so in this video, we're going to cover how to get your quads ready if you're about to go on a run. And these are a few tools that I use. Basically, it's a yoga block, modified foam roller that feels really good. It's actually kind of a silicone rubber, medical grade, very effective. As well as, yes, this yoga block, which is really nice. It's firm but soft, easy to clean, and it's a little wider than a normal yoga block and a little thicker. And the steel rod that spins with a nice soft coating on top of it with two swivel handles to really get into muscles to flush them and roll across the length of the muscles to get more blood circulation. So what we're going to do here is we're going to work on opening up our quads. And this is really good for runners, people who ride bikes quite a bit. And you can do this as a warm-up, but first we're going to do a little test just to see how tight our quads actually are. So what you want to do is you want to get on your yoga block, or you can get onto this block that I have from RAD. I'll put the links down in the description. And I take the rod. You could take anything else, anything that you could use to hold on to, just to create a little balance. Now I'm going to try to bring my heel up to my butt. Notice my front leg is actually holding the weight. I'm stabilizing and I'm below my kneecap and I'm pulling my heel towards my butt. It's a little bit tight. I can't quite get it there, but another thing that you need to keep in mind here is you want to keep your hips in a neutral position. You don't want to have them tilted forward or back very much, and keep your spine in a generally natural, neutral spine alignment as well with the natural curves. So now I'm going to test the other side and notice that I have the rod. Like I said, you could use anything else. And if you don't want to get these RAD tools, you can definitely find other things to make this happen. Notice how my heel is touching my butt on this side. Looks like I have really good quad flexibility on the right side. Hips are nice and neutral. My spine is nice and aligned and everything feels nice and balanced. I'm kind of pressing my left hand into my left quad just to kind of create some more stability. You can get a little less stabilization, nice little stretch. And now that I've recognized that my left quad is a lot tighter than my right, I'm going to take this rod, and it is steel, pretty much unbreakable. It does have two really nice swivels and handles to roll across the muscle. Now I'm really not pushing very hard here. I'm just flushing all the way from the hip down to the knee, just on the muscle. And just flushing, getting some blood circulation to all the tissues. And we're going to try to get some adhesions out or just get things moving. And then we'll try to mobilize the leg with some stretches and some active isolated stretches, and then you'll be ready to go. So again, just flushing through the muscle. You could probably use a pizza roller if you really wanted to. And I'm going to do about 20 passes overall, or maybe 10 passes on the medial thigh right above, basically the top, the inside towards the adductor, as well as out on the lateral side of the quad, which connects into the IT band, the vastus lateralis. So now I'm going to dig in a little harder after I do about 30 rolls. Just general, and I'm really going to try to get through any big, long lines of tissue that feel a little bit abnormal, a little bit sore, maybe a little bit locked down. Maybe it feels like it's got a bunch of bumps in it or knots. The idea is just to kind of dig in a little bit harder. And I'll do about 10 to 20 passes. It just depends, I'm really just trying to dial in the most tightest spot at that point. Now I'm going to dig in a little bit deeper, and what we're going to work on here is the lateral aspect of the quad, basically all the way up from the hip bone, the ASIS, the anterior iliac spine, all the way down the lateral side of the quad that connects into the side of your leg, the IT band, all the way down to the knee. What we're going to do is we're going to actually strip across the muscle instead of in the direction that the muscle fibers generally like to contract and stretch. So we're going to actually just lay down on our stomach, get comfortable, get some weight down on the roller. You can use a foam roller here. This RAD Helix is much more effective in my opinion. And all I'm doing is I'm rotating my hips up and down, and I'm starting up where the hip bone at the top of my pelvis, basically, all the way down to my knee on that lateral aspect. So I'm rolling across, I'm trying to press through any tight tissue, drop down a couple more inches, and I'm going to be rolling across. Back and forth. Try to keep a nice active core. You don't have to have it activated 100%, but you want your hips in a nice neutral position so you can really get the most out of the tissue release here. This is just another angle. You can kind of see where I'm just working my way from the side all the way back on that lateral aspect, dropping down about an inch. And I'm just rotating my hips. My hips are rotating and I'm putting weight down on it and I'm rolling across that tissue. It's absolutely super, super effective. It's not always the most comfortable thing. I recommend the Helix. Some of the rollers are a little bit too hard. If you have a softer roller, it feels good. Again, I'll put the links to the tools in the description. And go check them out. They're the best on the market. Lifetime warranty too. So I'm just working all the way down, taking my time. You can expect to spend 10 minutes to figure out which one's the tightest and which one you need to loosen up to balance out the two sides before you start running or cycling, whatever the case may be. Most important thing is that muscle needs to be able to stretch while you're moving. And the more it can stretch, the more energy and the more power you're going to have in your movement. You're not going to leak anything out through those adhesions and knots and restricted tissues that force other things to do something that they weren't really intended to do, but they have to pick up the slack because the adhesed tissue cannot move. All right, so now we're going to go into a little bit of a hip mobilization. So it's basically kneeling position again, just like we did in the test. And I'm going to make sure my hips are neutral, nice spine angle. And I'm just going to kind of shift my hips forward and squeeze my glute. And what I'm really trying to do is stretch that hip flexor. I'm trying to open up the hip on the left. I'm not trying to tilt it forward. I'm actually trying to keep those hips neutral while I drive my hips lightly forward until you feel a nice stretch. Now, we're not trying to overstretch here. I just want you to go to the point of where you feel tension, back off, maybe hold it for 1 or 2 seconds at the end range, and then come back up. And we're going to do about 10 of these. And this is more of an active, isolated stretch because we're actively moving through a range of motion while we're stretching the tissue, but we're not holding it long enough to really get it too stretched out that we may not be able to perform at our highest level because we don't have as much tension and therefore we can't create as much energy in our movement and power. The next thing we're going to do is actually internally rotate this left hip to the outside a little bit. So the foot's going to come out, not in, but out to the outside. It's going to bring that hip into internal rotation. Then we're going to reach across. You might want to grab the rod to balance on the opposite side if you feel unstable. We're going to reach over and across. It's kind of a little rotation. kind of reaching over and stretching out that whole lateral aspect of my, not only my my lower limb, but I'm also getting a good stretch through the QL, lower back, obliques, lats, and everything on that lateral aspect of the body. So that by bringing that hip into the internal rotation, you really created a real strong anchor to get a good stretch. And here's just another modification. If you don't want to do it with your hip internally rotated, you can just reach across diagonally towards the ceiling and across diagonally down towards the ground, and that gives you a really good active isolated stretch on that whole lateral side of your body. So when you do these activations and mobilizations, you should see a extremely big improvement in your quad flexibility. So now that we've done these two mobilizations, we're going to come back and test the two sides. So on the right side, we were pretty good at the start. So this quad was pretty good. If you look at my hip alignment, it's right underneath my shoulders. My knee is pretty much under my hip, and I can bring my heel to my butt. We're good there. Now let's try this left side. This is the side we did all the work on. Getting a nice lunge position, weight on your front leg for the most part, but keep it, stable. And point the toe up, bring the heel back, keep your hips in a nice neutral position. Looks pretty good. Now it still feels a little bit tight for me, but it's definitely improved quite a bit. So I'm gonna hold this a little bit longer, and I'm almost holding it as if I was doing this after my run. But to me, I feel like it's okay to static stretch if you don't have the range of motion. But as soon as you achieve that range of motion and it feels okay, you got to stop stretching it, because you're only trying to get it to the range that you need it to perform. You don't want to get any looser than that. So static stretching isn't always bad as long as you have a good reason to do it and it's going to help you perform better, as opposed to decrease your ability to perform at your best. So we're going to test it out here. I'm going to do a squat, which I just did, and then I'm going to do this pistol squat here. Yeah, that's always fun. Man, that feels really good. So I'm extremely happy with the session, and hopefully you guys tried this out and let me know how it works out for you.